Good afternoon. I'm Rhonda Connolly, and I'm on the board of directors of the National PKU Alliance, and I have been on the board for the full 10 years that we've been around. And I have a son who's 26 with PKU and 18 who's PKU. So I've been around our PKU community for a long while. And I must say that this year I am more excited than ever about what's going on in our PKU community. As you heard with Betsy Bogart this morning, there are a lot of companies interested in PKU. When my son was born 26 years ago, nobody wanted to do research on PKU. BioMarin has taken this to a great next level with 2 drugs that are now approved, and there are, like Betsy said, 20 or 30 different companies interested in doing research for a new cure and treatment of PKU. One of the key things she also said that is important that National PKU Alliance can do is our registry. To make a difference in our community and to help push the treatments further along faster, a registry is important. It's an important collection of data that we have control over, that we can make a difference with. So today we are excited to present to you a video that we have prepared on our registry that's going to be posted on YouTube, that's going to be available for all of our local communities to use in your PKU community presentations, and to help get our community involved in the registry. I just have a quick question. How many of you are already registered in our registry? Okay, a good chunk. But we're hoping to have everyone here registered by the end of this weekend, or at least ready to get registered. So, without further ado, we're going to go ahead and show our new video.
The PKU Patient Registry gives you the power to cure PKU. Few treatment options exist for individuals with PKU. While some advancements have been made, restrictive and challenging diet therapy remains the focus of treatment. However, there is now good news for the PKU community who face the daily burden of disease management. Researchers are interested in rare diseases like PKU. They want to better understand PKU, how management can be improved, and more importantly, how to find a cure. And now, PKU patients have a chance to make this possible by enrolling in the PKU Registry. The PKU Registry is an electronic database designed to collect and store information about the patient experience with PKU. Gathering information about rare diseases is a challenge. It is important for the PKU community to work together in greater numbers to share your experiences about the challenges you face daily. Utilizing the most advanced technology to ensure privacy, you can securely enter your personal health information into the registry, knowing that it will never be shared for advertising or marketing purposes. Researchers will use the information gathered in the registry to study PKU. When lots of people enroll and input their information together, researchers can launch more studies faster and analyze large groups of patients. You have the power to help researchers develop better treatments to find a cure. Working together, the future of PKU could look quite different than it does today. But this change is only possible with your help. Enroll today to make a difference. pku.imrare.org.
And now I'd like to introduce our Registry Coordinator. Because this is such an important part of NPKUA, our registry, that we hired Eileen Blakely to act as our Registry Coordinator. She comes from the PKU industry. She was a nutritionist at the University of Rochester for 25 years and dealt with PKU patients. And we've been lucky to have her as our Registry Coordinator, and she's going to present to you where we are with the registry. And Eileen?
Thank you, Rhonda. And we're happy that you all got to debut our video. we hope that you'll spread the word about it. It was a project that was fun to take on, and we're happy you could see it today. I'm very excited to be here. I've had the good pleasure for almost 2 years to have been involved in launch of the PKU Registry that the NPKUA took on the thought of probably 4 to 5 years ago. We began in January of 2017. There was lots of people that were involved in a very successful launch, and we'd like to share a little bit about what we've learned, both in terms of data, what we've heard from you, in terms of what you like, what you don't like, and we hope that you will consider joining us if you haven't already. So my slides go. So some of you may know the PKU Registry is housed on a platform that NORD sponsors. NORD is the National Organization of Rare Disorders. We're one of 20 rare disease registries. NORD became live with their rare disease registries in 2015, and NPKUA joined in 2017. So we're about halfway there. There's 20 registries live now, and we joined right about in the middle of that. I'm happy to report, though, that we are second highest in enrollment, and we're only second to a registry that launched in 2015. So NORD actually has told us that they consider us rock stars in terms of our enrollment because we've enrolled so many in such a short time. I'd like to kind of briefly go over some features of the registry so you have an appreciation for how it might be a little bit different or how it empowers you. Our registry, unlike some traditional medical registries, is patient-powered, and that means that we ask you to put your information by yourself. Registries that tend to be disease-specific have often been powered by medical providers or clinics where they take the information that they obtain from you in your clinic visit and the provider puts it in on your behalf. But we're patient-powered, and the NIH and the FDA are starting to appreciate the significance and the value of information that patients enter on their own, as it provides a perspective of where you're coming from. So we're very happy that we've chosen this perspective for a registry. Because we do collect private health information. It's on a secured platform, as the video mentioned, and as we have heard from you, it's very important for us that you understand this information will not be shared with advertisers. It will not be shared for marketing purpose. The reason that we will be collecting these data is for scientific research and the advancement of treatments and ultimately to find a cure. So we hear your concerns and we value and we hope that you can trust us that that is happening. We do receive research oversight from what's called an IRB, an Institutional Review Board. Any messaging that goes out to our participants, that is our individuals that are in the registry, all the messaging is reviewed by our IRB to make sure it's appropriate, to make sure it's not too coercive, and to make sure it's safe for you all to be participating. So we do have oversight. Control remains with the participant in the registry in a couple ways, and I'm going to go over that a little bit more later on. So a little bit about enrollment. For those of you who have joined, and I see there were quite a few, which is great, it's kind of a two-step process. You enroll initially by joining the NORD platform, we call it, and you agree to a set of terms and conditions to make sure you understand what's happening. And it is at that point that you can add a participant, or the participant is the person with PKU. And of the 750 of you that made that first step, you have entered a total of 650 individuals that have PKU, that range in age from very little to older. Of the 650 participants, about 70% have begun to fill out the surveys. So we do appreciate the fact that maybe you've joined, you've consented, and then you realize there's a little more work to do. So we have a little bit of a gap in those who have joined but haven't yet started to enter their information. We hope after today you'll feel excited and empowered to go on and take that next step. The great news is of the 70% of you who have gone on to complete surveys, we have 4,500 already, which we think is terrific. This just kind of shows enrollment in a different way. As you can see, between January and March of 2017, you were really excited to join us. Thanks to the help of clinics across the U.S., our great industry sponsors, and the people that helped to spread the word, to Brenda from Cook for Love, who coerced you with a few new recipes if you agreed to join. We had a really good response early on. But what I think we're even more happier about is the fact that you've continued to join. Even when those incentives were gone early on, our enrollment has been very consistent across every single month since we've started. And after 6 months to a year of the registry starting, we've also asked you to complete surveys again, and that's happening. So we're, again, very pleased with this trend in enrollment, and we're very hopeful that we'll continue not only to see people join up as new participants, but also to go on and to complete their surveys. So the next few slides that I'll show you contains information that we've actually gotten from the registry. And this will include information that comes from our surveys. So if you've been in the registry and you've completed a survey, you will be counted in this. We recognize there may be some people in here that haven't done surveys that might live in some of these areas that we haven't captured, but this comes from individuals who actually have completed surveys. One of the kind of demographical surveys that we have is called contact information, and that catches where people live or where they were born. So in our registry right now, we have individuals with PKU that were born in 18 different countries, which is a terrific representation kind of across the globe. They now live or reside in 8 different countries. We are a global registry. You can join wherever you live. Granted, our surveys and our focus tends to be on a North American focus. We do have individuals that have joined and are completing our surveys. We represent actually 3 U.S. states. Someone from Oklahoma joined since this slide was done, and individuals from 6 Canadian provinces. The very first survey that we ask you to fill out is called About the Participant. As you can see on this slide, 439 of you have done this survey or answered this question. And in blue, you can see that that would represent a parent of a child with PKU has answered the question. 38%, I can see my glass, would be an individual 18 years or older that has answered. And that yellow LAR stands for a legally authorized representative, which likely would be an individual that perhaps was diagnosed late with PKU and has someone else completing surveys for them. So that would be considered LAR. Not surprising, we have a large percent of our registry right now of parents of children that have PKU, which is great. We hope that as our registry continues down the line, that some of these children that have enrolled will become 18 and older and will move on to complete surveys themselves, as this commitment to the registry is a long-term one. But right now we are fairly heavily parent-focused. So what about our gender and age? Again, those individuals that completed the About the Participant survey that completed this, we know that we have 267 females, and I'm having a hard time reading that with my glasses, but I think around 267 females, so largely under the age of 18 again, and 100 and, what's that say for men, 184? And it looks like we have about 75% of those guys that are under 18, so this represents that. Our oldest registry participant is 66, and we have 7 individuals who are 60 or older with PKU, and our youngest registry participant joined at 1 month when mom and dad were probably still really sleep deprived, and we have 17 infants in our survey, in our registry right now. I'm going to highlight information from 2 of our kind of important surveys. They're all important, but these 2 are considered longitudinal surveys, and that we do ask you to complete these periodically so we can track to see how things are going with you. The first longitudinal survey is the Diet and Treatment Survey. This tends to be one of our longer surveys. We have found that you're not really fans of longer surveys, but it really does contain information that's very important for us to collect. The diet and treatment survey is 19 questions long. As diet therapy is a very important component of PKU, it does collect information about that. We ask specifically what medical food you are on, the amount of that medical food, and if you take that medical food. We ask about the use of low-protein modified foods, and by medical food, I should clarify that that also means formula. And then a little bit about what happens for your monitoring, how often you're testing your Phe level, and what's happening during your clinic visits as well. So I'll share a little bit about what we've learned. So far, we have had 300 individuals complete the diet and treatment survey at least once. Those who enrolled back in January of 2017 have actually been asked to complete this 2 more times because we request that it be updated every 6 months. Obviously, when you think about our population of little ones in the registry right now, we see that 99% have followed a restricted diet at some point, and 92% are following the diet now. So we're thinking perhaps as the age of our registry participant is higher, that we might see a different percentage of this. But right now it kind of makes sense that our younger children are probably more adherent to their prescribed nutrition therapy. We also see that 10% have discontinued diet at some point, and of those, about a third have tried to get back on. Similarly with medical food or formula, 90% take their formula almost all the time, which I think is a very strong indicator that we have little ones in the registry, and 10% take it just sometimes. How frequently does the participant actually check Phe levels? And I think that's an important point to know, that we're trying to capture what's actually happening. When you leave your clinic having been told to check levels maybe monthly, that might not actually be what is happening, and we're looking at that now. And you can see again, probably reflecting the age of our participants, 43% are checking monthly, and about another 35 or so % are checking either every week or every other week. So a large percentage of our population in the registry are checking their levels pretty frequently. And what I didn't point out here is that 289 of our participants answered this question. Something also that I hope some of you that are in the registry have noticed is that you can access graphed information as well to see how you compare. In the diet and treatment survey for this question, there's a tab that says graphed results. And if you click on that graphed results button, you will see a chart similar like this that will come up and show you how you compare. It won't have the percentages in, but at least it gives you an idea of how you compare with other people that have entered information in the registry. And you can kind of also see how many people have done that. The next longitudinal survey that is quite important is the medical history survey. Again, a little bit longer. This has 20 questions. And this does ask you to recall sometimes some dates that you may or may not have the information for. If you come to a question that you don't have the information for and you can't find it, unless it's a mandatory question, which you would know by a little red asterisk, you do not need to complete that. So we allow you to kind of progress through the survey questions that you can answer. But in the medical history survey, and you can see that 280 people have done that, we ask questions about general health, questions about hospitalizations that may be related to PKU and are not related to PKU. And then we ask questions about kind of medical areas or systems that likely your providers are following in your clinic visits, and we ask you to provide some kind of specific information about that if you had it. As you can see, there are definitely questions that pertain to neurological questions and questions that pertain to brain health, and I'm going to talk a little bit more about those in a minute. So the very first question that you'll see on the medical history survey is, in general, at this time, the participant's overall health is. And again, you can see 75%, well, actually 95% of the participants in the registry rate their health as either excellent, good, or very good. So we have a pretty healthy population in our registry right now. Thinking about babies and younger children, this probably isn't surprising. Things look maybe a little bit different for the next slide, and this by no means is statistically significant or in any way reflects anything that we could give to researchers now, but I think it's interesting to note that there is a little bit different in the way that this slide looks compared to the last slide. So this question is worded in the medical history survey: has the participant ever experienced anxiety? And there's a separate question that asks the same thing about depression. So 275 individuals answered the question about anxiety. And here, where in the general health question we had a pretty large blue area, here it's a little bit smaller. 50% said no, they hadn't ever experienced anxiety symptoms. But a larger percentage in green reported that they did. The yellow likely represents an answer from a parent of a baby or a young child in which anxiety or depression couldn't really easily be determined. So that's why that yellow is there. Similarly, we ask about if anyone experienced symptoms of depression, and we see 66% had not, and about 24% had. And again, some, not all of these results will be graphed, and you'll be able to see them when you're on yourself. So as important as what we've learned from the surveys is what we've heard from you. Because the NPKUA is dedicated to having this registry be around for a long, long time, which is actually unusual for registries, we want to make sure that we're listening to what you tell us and making changes or adapting things in a way that will keep you involved. One of the biggest things we've heard is that it's tedious and you don't like entering single levels at a time, or it's hard to kind of go back and look up information from clinic visits, and we get that. There's a couple things we can do to help you with that. The very last survey that you'll see in your list of surveys is called the Upload Survey. And I know there's PKU parents out there that might keep Excel spreadsheets of fee levels, or might keep a Word document of fee levels, or keep fee levels on a piece of paper. If you have the ability to upload or scan those documents, you can actually put them into yours or your child's upload survey, and we can enter those on your behalf. So we realize when enrolling, let's say, a 12-year-old, you've amassed 12 years' worth of fee levels, and chances are likely that you're not going to sit and enter each of those, but we can help you with that. Down the road, we are working with NORD, and I wish I could say it would come soon, but it probably won't, is the idea of mapping or automatically depositing information into the registry. So my clinic in Rochester, New York, if that individual is enrolled in the registry, they would be allowed to sign a permission form for University of Rochester to automatically transmit their fee level into the PKU registry. This is something that indeed is on NORD's radar, quite complicated with different EMRs and different privacy things, but this is something that we are thinking about and we think would help. We heard from you that you'd like us to be more mobile friendly, so when you get the fee level and you're sitting in your living room, you can just pick up your phone and put the result in, so that's something also. And we do have the ability, and you should be seeing this over the next few months, to conduct lightning polls, where we might just, who are registry participant, throw out a random question and have you answer it. And at that time, you will be able to see the results that everybody is sharing with us. So lightning polls keep it a little lighter and make it a little more fun. We, as I have mentioned, have longitudinal surveys, and we do ask you to update those every 6 months to every year. And they're set up in a way now where we're recognizing that some of the questions that we're asking you to answer have been duplicated, and we probably don't need to ask them again. So again, within the next 6 months, I hope that you'll see in those longitudinal surveys that they've been adapted to be a little bit easier to fill out, a little less cumbersome. It's something, thanks to the information that you've shared with us and that we've seen, we'll be changing those up. And the communication preferences, I just like to mention this because when you start a project like this and you think it's so clear and you think, oh, of course they'll understand what that means, you realize very quickly sometimes that you're wrong, that it's not clear. You have 2 ways to control communication that comes from us or from the registry to you. And these are very important, and we respect the fact that you might not want to be bothered about things from us. The first is can we contact you directly question. When you enroll your participant or yourself, you're asked, yes or no, can we contact you? The reason I bring this up is because the way it's worded on the initial form would lead you to believe that I might be contacting your 3-year-old who you have just enrolled, and I won't be. When you enroll a child, I'll let you communicate with your 3-year-old, and I'll contact you with questions. So if you say, yes, I can contact you, I'll be contacting those parents of those children. If you're not sure what you've answered to that, you're in the registry, there's a way to check it, and there's also a way to change it by going to an edit tab in the participant where you enter your participant. Or if you're not sure, I'm happy to help you figure that out at the registry table this week. The next area of control that you have in communication is whether or not you want to be reminded to complete those longitudinal surveys. We ask you to update your treatment and diet survey once every 6 months, and there's a few other surveys you can see there that we ask you to update annually. If you check yes, I'd like to be reminded, you receive 1 single email from the platform automatically, either 6 months to the day or a year to the day that you completed that survey initially. You won't receive multiple emails, only once. I will tell you that I hope you've seen our messaging on Facebook and Twitter. I hope you've seen us out and about, but we do tend to remind people about those longitudinal surveys and the importance of completing those as well. So we will be in touch with you, but you do have some control over the information that you're receiving from us directly in the registry. And I know that many of you were listening to Christine this morning because I've had a lot of people already approach the registry table and want to sign up, which is terrific. But I do want to point out that we have an incentive in your package. There's a form called the PKU Patient Registry at the NPKU conference. And this explains what we're asking. But if you have not joined the registry yet and it's something that you would like to do, this would be a good time to do it. If you join and consent and complete 5 surveys, and there are 5 surveys that you should be able to do that doesn't require you digging up notes from your clinics, we'll give you a $10 Amazon gift card. If you're already in the registry and you have surveys that are due to be updated, you can check that out by the Surveys to Retake tab, or again, I can help you figure that out at the registry table, and update those as best you can. Just to note that if you are updating while you're here, those surveys do ask for some information that you may need to obtain from your clinics. So do what you can, and then you have the ability to save a survey as a draft, and when you get home, you can finish that up. We'd prefer that you be as complete as you can, and once you save a survey as final, you can't get in and make any changes. So once you've done your work on your surveys, you fill out this form that I held up, and you can bring it to the registry table. I'll be at the registry table this afternoon into the evening, and I'll be at the registry table all day tomorrow, and Rhonda and I can help you get set up or signed up, and we can collect your forms, and we can give you your $10 Amazon gift card. For all of those forms that we collect for everybody that's joined the registry during this time, or if you have arrived to this meeting with your surveys already up to date, and I know some of you have, just check that your surveys are up to date on that form and bring it to us. But of all those papers, on Sunday morning before we get started, we'll be drawing for one $100 Amazon gift card. So again, we appreciate that this involves some work on your part, but if this is something you've thought about, and obviously you're hearing how much we rely on good data and research to advance things, this is a great time to join in. So I'm going to end by thanking all the people that have made this possible. We had a wonderful group that worked for many years to get the registry off the ground. We had a group of dedicated parents that kind of slogged through a demo registry and helped us figure out what questions that we had were good and weren't good. We have a wonderful registry committee that is comprised of parents and providers that kind of keeps us on track and helps us see what we do. But most importantly, we have you. We have you who, at the end of the day, after chasing a toddler around for a fee level or fighting with your insurance company, you sit down and you put in a fee level, and it means a lot. So thank you for your time, and please stop by the registry table today.